Hi, my name is Michelle Worth, and I'm going to be talking to you today about being a CNA in a hospital setting and what is required of a CNA. In hospitals, CNAs are usually the eyes and ears for the nurses, who in turn are the eyes and ears for the doctors. So it's very important as a CNA to do the duties that you are required to do, and also to go above and beyond what is required to make sure that the patient is safe and gets better. One of the things that a CNA does is check vital signs according to what the doctor orders. Sometimes that's once a shift or twice a shift. Sometimes more often, depending on if they've had surgery or some other procedure. Vital signs are important because they give the nurse an idea of what is going on physiologically with the patient. For example, if their blood pressure is very low but their pulse is very high, the nurse may think to themselves that they are going into septic shock, possibly following pneumonia, the flu, or even surgery. And they will probably order some labs to be done on the patient to make sure that their lactic acid levels aren't elevated, which is also an indicator of shock. These small things, such as blood pressure and pulse, actually can play a very significant role in detecting problems early in somebody's sickness. Another thing that the CNA does is we do routine cares on the patient. Routine cares are things like bathing the patient, washing them after they're incontinent, ambulating them to the bathroom. In the hospital, patients, especially the elderly, are much more prone to skin breakdown from not moving. The mattresses are made out of plastic, so they're non-absorbent. So as a CNA, we have to make sure that we are following the facility's protocol, and we check on them at least every 2 hours or more, depending on if they are ill. Another thing that the CNA does is intake and output. These are important for patients who are in congestive heart failure or renal failure, which is your kidneys. Some CNAs don't find this very important, but a patient who is in congestive heart failure can sometimes have a weight gain in 24-hour period of 5+ pounds. This means there's additional 5 pounds of fluid in their body because their heart isn't pumping as strong as it used to, and that can lead to third spacing issues, which can lead to other chronic illnesses. The CNA has to be able to communicate effectively with the nurses, other staff and ancillary staff, and the families of the patients. You have to know what is allowed and what is not allowed. HIPAA is a very important part of any healthcare worker's code of conduct. We cannot disclose any kind of health information to a patient's family or friends without the patient's express knowledge. We also cannot tell patients what are results of tests that they have had done. Sometimes CNAs do have a patient that will ask them specific questions such as, do you know the results of my lab work or my echocardiogram? A CNA is never allowed to tell those results. We are not doctors. We are not able to diagnose a patient, and it is very important as a CNA and a nurse even to remember that we cannot share that info. Another thing that a CNA does is advocate for our patients. Patients sometimes feel like they are alone in a sea of nobody else. They are scared, they are not in their own home environment, and they don't know who to turn to. We have to be willing to take the time and listen to our patients. Sometimes they may feel that taking pain medication indicates that they're weak. And if they have had surgery or broke a bone, they may be suffering from a lot of pain. So it's important to listen to your patient, let them know it's okay that you're in a hospital, it's okay to take pain medication if you need it, and to also let the nurse know that the patient doesn't feel that they're being taken care of adequately as far as their pain goes or getting answers. Doctors are always a phone call away, and the patients need to know that they have rights. They have the right to know what their treatments are. They have the right to know who's taking care of them, also what medications they're taking, and also they have the right to refuse. As a CNA, all you can do in regards to that is pass that on to the nurse. The nurse is ultimately responsible. It is their license to make sure that these patients are taken care of and following specific orders to that patient. The CNA is a multifaceted job. It is very important, and sometimes it's underestimated how important a CNA is. As a future nurse, I feel that it's very valuable that I've worked as a CNA for so long, because I know that working with a good CNA is something that will make sure that the patient has the best care possible in a hospital situation. Thank you for your time, and have a very nice day.
Good job.
How many minutes was that?
5.